Whether you're approaching retirement, helping a loved one choose their options, or navigating open enrollment, understanding Medicare can feel overwhelming. That's why we're breaking it down, what it is, how it works, and how to make smart, confident choices. To guide us, I sat down with Tim Smolen, Program Manager for SHIBA, the statewide health insurance benefit advisors program at the Washington State Office of the Insurance Commissioner. SHIBA is a volunteer-driven resource that offers free, unbiased Medicare help to Washington residents. Tim brings clarity, insight, and practical advice. Here's our conversation. Hi, Tim.
Hi, Marguerite.
We're here to talk about Medicare.
Exciting for me.
Exciting. So, will you tell me, what is Medicare?
Sure. Mm-hmm. Medicare is a health insurance program for older adults and people with disabilities.
And it's open enrollment time, isn't that right?
It is. This is a peak season for us, right? So, like, my wife is from Vermont, and they have, like, peepers, the people that come just to see the leaves change colors. Mm-hmm. So that's peak season for them. Open enrollment is peak season for us.
Okay. So what does that mean? What does that mean for somebody who might be looking at Medicare to get on Medicare, or if you have Medicare already? Yeah.
So the main audience here are going to be people that have Medicare, and this is kind of your once-a-year chance to kind of rethink about, do you have the best value for you for next year?
And how do you know what does best value mean?
Well, it means different things to different people. And our main goal, and thanks for having the Jumpstart Toolkit here, is we just need people really to engage the conversation. The typical thing is, for whatever reason, people just look away, and we need them to lean into this conversation, because it's the time to say, have I got the best provider network for me? Have I got the best prescription drug coverage for me? Am I paying too much for my insurance? Are there ways to save money? So it's generally, value looks like kind of that arrangement.
Okay, so since you brought up the cost, am I paying too much already?
Yeah.
Is everyone going to actually experience a rise in their Medicare premiums?
Yes, they are.
Okay.
So maybe we could just have a quick primer about kind of basics of Medicare. And
that would be great.
A little context.
That would be great.
The Medicare program is 60 years old this year. So it started 60 years ago. It was part of President Johnson's Great Society programs. And it was really modeled after what was modern insurance back in 1965. So we have Part A, which is hospital insurance, and Part B, which is optional medical or outpatient services.
Okay.
So what was happening in 1965 was the president was modeling after Blue Cross plans were hospital insurance, Blue Shield plans were medical insurance. And Part A looks like Social Security. In fact, Medicare amends the Social Security Act 1933. So Part A, there's a deduction that I pay out of my payroll taxes. It goes into the Medicare Trust Fund. So when I turn 65, I will not have a premium. Medicare Part B premium back in 1965 was $3. Next year, it's going to be more than $200.
Oh.
So it's going to increase from about $185 this year to $200 next year.
Okay, that's across the board.
So everyone's looking at a rate increase.
And what about prescription drugs?
So prescription drugs is new to Medicare. So we just had legislation to make Medicare Part D just in the last decade. And that is optional coverage as well. So most people need some coverage for prescription drugs. And for most people, that's going to be a Medicare Part D plan. You can choose to get that as what we call a standalone Medicare plan, or it can be incorporated into your Medicare Advantage plan coverage. So we'll have to talk about what each of those expressions means.
Ooh, you brought up a new term, Medicare Advantage. What is Medicare Advantage?
So also relatively new, right? So in 1997, President Clinton signed the Balanced Budget Act 1997, and it really created the modern Medicare Advantage system that we have today. At the time, it was called Medicare Plus Choice Plans, or Medicare Part C. And the idea was that we could kind of take, again, borrowing from industry, right? This is kind of the typical story of the Medicare program, is like, it seems like private companies are saving a lot of money with managed care arrangements. Shouldn't Medicare go that same direction?
I see.
So it created an alternative path, if you will. We had original Medicare, and now we had Medicare Advantage plans, which were the government contracting with private insurance companies to bring kind of managed care to Medicare as a way of kind of bending the cost curve, if you will.
So maybe you can recap a little bit, just to explain what's the difference between being on traditional Medicare versus Medicare Advantage.
Of course, sure. And this is exactly the kind of question that comes up during open enrollment, because this is where people might switch from the Medicare Advantage to original Medicare or original Medicare to Medicare Advantage. That's one of those kinds of things you can do only during this period of year for next year. So historically, we had original Medicare. You got a red, white, and blue Medicare card, and A was hospital, B was medical. But for most people, that wasn't really enough insurance. So again, it was modeled after what was contemporary back in 1965. So it's like major medical insurance. Its purpose was to keep you from being bankrupted if you needed medical treatment.
That's important.
But it's not like the modern way we think about healthcare or the modern way we think about insurance, which is it should pay for preventive care benefits. It should pay for prescription drugs, right? It should incentivize you to take care of yourself, not just indemnify you if a bad thing happens. So again, original Medicare is still that sort of bare bones, no Halloween illusion intended, right? That's your kind of skeletal coverage. But most people are going to have other coverage in addition to that. So again, if I think about the toolkit, we're going to broadly describe 4 kinds of personas. So your extra coverage, besides Medicare, is going to be Medicare Advantage plan, a Medicare supplement plan. You're going to get insurance from the place you used to work at, so you have retiree health insurance, or you have benefits through Apple Health Medicaid. So Medicare plus something else.
Oh my goodness, so many plans.
So many plans.
Now, so much information, so many plans. I can imagine, and actually we hear this, and even I do this with my parents, this is like, it's a challenge. Who do I go to help me walk through this myriad of plans?
It's such a formidable challenge. And again, the main thing is go to someone. Don't just kind of bury your head under the covers and wait for it to go away again. I think one of the things that's very challenging for people starting in Medicare is it's so different, and it's not what they expected. They're used to the kind of coverage they had when they were working. And this is so different than that, right? And when you were working, open enrollment was probably just a non-event. Your premium might have gone up a few dollars, or you might pay a little bit more for your copays. But with Medicare, the changes are more continual and more significant. And so, again, what most people do is they don't seek help at all. There's a great review by the Commonwealth Fund that about 7 out of 10 Medicare retirees don't do anything about open enrollment. They just coast right through it. And for some people, it's not the end of the world. But because half of our people are in Medicare Advantage plans, we have thousands and thousands of people every year whose plan is discontinued for next year. And then they call me in January in a panic.
Right.
I went to the pharmacy and they said, I don't have insurance anymore.
Right.
How come no one told me?
Right. So in that case, what happens?
Well, then we're going to reattach them to their insurance. But it's not going to be as good as it was before because now they had a break in coverage. So they're going to have bills that they didn't need to have.
Right. Okay, so I have heard about SHIBA volunteers.
Excellent.
Who are these, and what is SHIBA?
SHIBA volunteers are the best people in the whole world. So we take a lot of pride in our program in Washington State. We call SHIBA. So SHIBA means Statewide Health Insurance Benefits Advisors. We were actually started by a local group of volunteers in Stanwood, Washington, 45 years ago. And this is a bit of a stretch of imagination, right? So imagine a bunch of people, older people, who said, gosh, Medicare is really complicated. Wouldn't it be nice if you had someone to turn to for help? I often think if they could see the world 45 years later and appreciate how much more complicated it is. But it was initiated by a group of volunteers in Stanwood. They approached the insurance commissioner's office and said, you really should adopt us as part of the consumer protection mission of the OIC. And we did. So we were a SHIBA program before there was SHIBA programs.
Wow.
Now there are programs like ours in every state in 4 territories. Broadly, we're called SHIP programs, Senior Health Insurance Assistance Programs. So if my mom is in South Carolina, she can call the local SHIP program in South Carolina, and they're all run by local volunteers. So the professional staff like me train volunteers who then would counsel someone like your mom, and we would sit with you on the phone or in person and have a conversation about, hey, Marguerite, how's it going? How can we help? What are you challenged about?
Okay, where do I go to find one of these SHIBA volunteers?
Well, if you're a website person, you're going to go to our website, and that's www.insurance.wa.gov. If you're a telephone person, that's 1-800-562-6900.
And what information do I need to have available when I call?
The more the better. So again, in our toolkit, we're going to say it would be great if you had these things on hand and brought them to your appointment. So we're looking for like, which doctors do you like? Which drugs are you taking? Do you have a preference about pharmacies? And what kind of insurance do you have right now? Because a lot of people honestly don't know what insurance they have right now. So we're going to say, bring your wallet, bring your purse, go to the cupboard, go to the place where you keep your mail, and bring that with you, because we will then help you. What your rights and options are for next year depends on where you're starting from today.
So when, as people are looking at these different plans, and I think having advisors certainly is probably the most beneficial way to go about it. But do you hear stories of people who have been like, oops, where does it go wrong?
We do hear those stories. And, sometimes it's just like an owie, and sometimes it's more traumatic, right? The things that go wrong. So I would say a very typical thing that we're concerned about, back to your earlier question, is people getting started. So people don't really understand how to get started. So that's typically where it's going to start to go wrong. So say like a worst case scenario for us is that you didn't understand that Medicare starts at 65, even if you're waiting to take Social Security at 67 or 70. And so you might have blown right by that 65 birthday and not done anything. Right?
Oh.
Because a lot of people are waiting
Right.
to get Social Security to optimize their benefit, but they're not joined together anymore, right? 65 used to be the magic age for both.
Right.
And so for some people, it's going to be fine, right? If you're working for the state of Washington and you have health insurance from your job, you can coast past 65. But if you're a person, say, who's in the Obamacare plans, when you get to be age 65, you're going to get a letter that says you can't have both. Choose.
Oh, okay.
And if you miss that, you're
So-
going to get put out of your Obamacare plan,
Right.
and now you're going to be late to sign up for Medicare, and then that's bad.
But we know a lot of people who are working well past 65,
Indeed.
right?
Yeah.
So let's say I work for a company that provides insurance, but I've turned 65. Should I still apply for Medicare, or what happens then?
So it's a little complicated. And so what I'm going to say is, again, back to the idea of personas, it's going to depend upon the person that you are. So if I was to draw it like a 2x2 matrix, the two things that I'm concerned about then is, are you already drawing your Social Security benefit? Because some people will do it earlier or at 65, and some people will do it later. The second dimension that I care about is, are you covered by a group plan? And ideally a large group plan, right? So more than 20 people, more than 100 people. And that distinction is about whether you're qualifying for Medicare by age or disability, because Medicare actually is aged and disabled people, right? And we don't talk enough about Medicare and people with disabilities. Okay, so the first question about Social Security or not. If you're already drawing a benefit, you'll be automatically enrolled into the Medicare program.
That's good.
It's good, unless it's
good.
not, and we'll
Right.
talk about some of those wrinkles.
Oh, okay.
But a lot of people aren't, and so then they don't know what to do. And they might do the wrong thing, or they might do nothing, but that probably would be on our top 5 list of questions, right?
Interesting.
Because if the Medicare Part B premium is $200 a month, and I don't have to have it, can I wait to sign up? And the answer is probably yes, but let's make sure that we understand your circumstances. So automatic enrollment for people drawing a pension, not automatic enrollment for people that not. On the second dimension, if you're still working, best case is you're working at a large group employer, you have benefits that are as good as the Medicare benefit, no worries. More worrisome, you don't. You misunderstood. You don't have coverage that's as good as Medicare. You're going to have a penalty for being a late enrollee, and that's going to be significant.
Wow, so much to
So much.
to absorb and to learn about.
Yeah.
So back to the SHIBA volunteers for just
Yeah,
a quick second,
sure.
because I hear that they are in really high demand right now.
It's true. So the first thing is we need more SHIBA volunteers all the time.
Okay.
And so we're really hoping that your viewers or your listeners or your subscribers or members will consider being a SHIBA volunteer, because it's exceptionally rewarding and it makes such a big difference in people's lives. But we provide all the training for people, so you don't have to actually know anything at all about insurance or Medicare or healthcare. We can train you to do it. We just are looking for kind, caring, patient people.
And is that only for during enrollment period, or if I'm a SHIBA volunteer, is it sort of a year-round opportunity?
You're going to be busy year-round. You're going to be more busy during open enrollment, but it's the steady stream of I'm turning 65, or I just moved here, right? Washington State is a big retirement destination, or people, kids moving their parents here to have them closer. So we're busy year-round, but open enrollment is kind of peak season. But someone's always turning 65, someone's always moving here, someone's always having an issue or a concern navigating Medicare, so we help with potential fraud cases, we help with just complexities about referrals, authorizations, complaints, grievances.
Can you tell us about this Medicare Jumpstart toolkit that we have here?
I can, and thank you for having one of these. We're very excited about this. This is kind of a first-in-the-nation initiative here, and it really comes out of the fact that so many people are reluctant to seek help. And so the thinking behind this is, what if we gave you a tool that would help you get organized for an appointment if you're going to have one, or help you self-serve? Maybe you just need some help navigating. Like, there's lots of jargon and there's lots of technology, but maybe if we just had a little bit of a roadmap or a script, you could find yourself in it, sort of choose your own adventure and then navigate your way through. So hoping to promote health self-service, or alternatively, just help you get better prepared if you're going to have an appointment with a SHIBA volunteer or an agent or a broker. If you're going to call 1-800-Medicare, at least you'll be able to have a better quality conversation.
So the last question I have for you is, we work a lot here at ARP on fraud and scams.
Yeah.
Do I need to be concerned if somebody calls me up and says, hey, I have a Medicare plan to sell you? Or do I need to be concerned if someone says, I'm happy to help you, can you give me your Medicare number?
You should be very concerned. You should never do either one of those things.
Okay.
So the first thing that we tell people is Medicare is never going to call you. Medicare does not make outbound phone calls to you. So if someone says, hey, this is Tim, I'm calling from Medicare, you can just hang up the phone. They don't do that. You can call them, but they will not call you. The second thing is there are, unfortunately, lots of very sophisticated fraud schemes out there. Just with all the kind of thievery that happens, the person on the phone is going to sound very convincing, right? They will have lots of information about you that's going to lead you to believe that they really are credible, but they're not. So what we're going to say is don't take those phone calls. And if they do, say, you know what, tell me the number where I call you back. And then make that outbound call to 1-800-Medicare, or make that outbound call to us. The Washington State SHIBA program is also the Senior Medicare Patrol Project.
Ooh.
So we talk about prevent, detect, and report fraud. And so if you think you've been a victim of a fraud or you're concerned about that, you can bring it to us and we will escalate it then to the appropriate agency.
Tell me again the name of that squad.
Senior Medicare Patrol.
Love it.
Yep.
Hey, thank you so much for taking time out of your day.
It's my pleasure, Marguerite. Thank you.